Injuries in tennis are very common, and it really breaks down into two categories. One are the acute injuries, things like ankle sprains that occur while running. But the other group, the more common group, are the overuse type injuries. So tennis players hit a lot of balls, they hit a lot of serves, so we see a lot of overuse shoulder injuries, elbow injuries, wrist, even low back injuries. With regards to shoulder and elbow, which is my specialty, rotator cuff problems can definitely develop in young players, but especially in older players. And then at the elbow, things like tennis elbow are clearly very common. Tennis elbow is really an overuse syndrome of the elbow, and it's the extensor muscles, the muscles that are on the lateral side of the elbow. And it was described as it pertains to tennis players. If you hit a backhand and your form isn't very good, it can put a lot of stress on those muscles and cause, quote, tennis elbow. But everyday people can get it. It's not just athletes. Anything that's repeatedly using your elbow or wrist that in an overuse type fashion can cause tennis elbow. And basically, it really ranges from just inflammation in the tendons that attach to the outside or lateral side of the elbow to even tearing. So it's really a spectrum of disease, but we use the term tennis elbow to describe all of them. So the symptoms of tennis elbow are pretty classic. Patients typically have pain over the lateral aspect of their elbow, and it's really point tender in that area. And then they'll often complain of pain with everyday activities. If it's their dominant hand, like opening doors, pouring juice, shaking hands, any of those activities that really kind of involve sort of using the muscles of your forearm and your wrist can exacerbate the finding of tennis elbow. Tennis elbow, as I mentioned before, really kind of presents in a classic way where they're typically tender over the lateral epicondyle or the outside of the elbow. But clearly, to make the official diagnosis, you want to see a doctor, and they're going to take a thorough history and do a physical exam. There are certain physical exam tests that will really help identify tennis elbow as the cause of the pain, because other injuries can sometimes cause similar symptoms. And then an ultrasound or MRI would be the definitive way to make the diagnosis. So the good news about tennis elbow is that it typically responds very well to conservative treatment. And by that I mean it often does not need surgery. About 90% of the time it's going to get better with some combination of therapies, starting with rest or activity modification. So if it's a tennis player that's been playing a lot, oftentimes by sort of backing off on their activity, that'll help. Anti-inflammatory medications can help. The gold standard for getting tennis elbow better, though, is physical therapy, and the physical therapy at Aspetar is great for that. If that doesn't work, or to try to speed up the recovery process, different injections have been described as well. So most people are very familiar with cortisone injections. Cortisone injections work well for tennis elbow, and probably even better are PRP or platelet-rich plasma injections. There are some good studies that show good results with PRP injections for tennis elbow now, and they hopefully avoid or get people better and avoid surgery when they would have needed them previously. Clearly, any sport is the athletes are going to be subject to injury, and as I described earlier, there's really two main sort of groups of injuries in tennis players. One of those acute injuries, like spraining your ankle, which are going to happen. You're running, things like that happen. It's almost more bad luck than anything else. The overuse injuries, though, those are the things that we can hopefully do a better job of preventing, and I think it really involves working with the physical therapists, the physios, the trainers, to make sure these athletes are as flexible and as strong as possible. And also identifying sort of the warning signs for injury. If they're starting to fatigue a little earlier, if their range of motion is starting to decrease, if they're getting a little weaker, these are all signs that maybe some injury is starting to percolate or come to the forefront. And if we can stay ahead of it, I think that's the best way to prevent it from becoming something more serious.